Daryl, wait on one more. All right. Okay, yes. You guys can come a little closer. All right. Well, thanks for being here today to hear about a drug trafficking organization that was dismantled by our narcotics unit, and also learn about a dangerous drug that is emerging in our community as a public health threat. I'm also joined here on stage by Assistant Statewide Prosecutor Ashley Wright and Captain Daryl Blanford. Our drug unit took down this drug trafficking organization, which was selling fentanyl mixed with xylazine, which is a powerful tranquilizer. The Office of Statewide Prosecution has taken up the case and is prosecuting some of the high-level suspects in this case. So all the people pictured in my poster to the right, with the exception of one, have been arrested. And the ringleader, Jasmine Montanez, is still currently in Orange County Jail, and if convicted, faces up to 25 years in prison for her role as the ringleader of this operation. But part of the reason we are here today is to make the community aware about the dangers of xylazine, which our drug agents are finding in many of the drugs we are confiscating through undercover drug buys throughout Orange County. Xylazine is a very powerful sedative used on animals during surgery. It is not approved by the FDA for use on humans because it causes dangerously low blood pressure, which could lead to death. It's also not regulated by many other drugs. So perhaps the scariest thing about xylazine and its prevalence in street drugs here and throughout the country is that it is not receptive to Narcan. We've seen a lot of success in reviving people with Narcan who have overdosed on opioids, but Narcan does not work on xylazine. That's how dangerous it is. And so we've had 3 overdose deaths this year in Orange County that are linked to xylazine, and we had 2 last year. So we can't stress how important this is to let our residents and visitors know the dangerous effect of xylazine in our community. And so now I'm going to turn it over to Captain Daryl Blanford to talk about some of the specifics of Operation Moscow Mule.
Good afternoon. Operation Moscow Mule was initiated when our undercover narcotics agents were able to infiltrate a group and make buys from 12 different undercover hand-to-hand drug buys, ranging from $5 bags all the way up to 100 packs that were used for distribution throughout South Orange County. You can see these are the targets over here that the agents were making buys with. At some point during the investigation, they were able to locate the supplier up in New Jersey, and working with an interdiction unit in Volusia County, they intercepted one of the mules coming back, destined for the Oak Ridge corridor in Orange County, and knocked off a ½ kilogram of fentanyl. The area that it's destined for is what we refer to as Zone 43, the Trail Oak Ridge area. From 2022 up to currently, they've had over 150 overdoses in that area with 9 fatalities. So the drugs were targeting an area that we're already having massive problems with. This case in particular is significant because it's like many others that we're seeing now. It is illustrating a growing trend of xylazine being mixed in with fentanyl. 5 years ago, you wouldn't even have seen xylazine in any of the drugs. It's grown from 1% to 7% in 2018. Now we're roughly at about 80% of the fentanyl that we seize in undercover cases contains some form of xylazine in it. And those numbers are mirroring what a DEA source on a study over 10 major cities in 2022 found that they're roughly in about the 80% range as well. So you can see that it's accelerating at an extremely fast pace. And we'll talk about some of the issues now. The issue with xylazine, unlike fentanyl, is, as the sheriff mentioned, it's not an opioid. So naloxone, or as you know, Narcan, has no effect on it. And that's a problem we run into when your partner is overdosing and you believe that the Narcan you're using is going to be effective. It's not. So they sit there and continue to overdose over and over again because you think you're attacking a fentanyl problem and you're actually attacking a tranquilizer problem. They're 2 different things. Another serious complication this particular drug can cause is a necrosis of the skin or the rotting tissue at the injection site where you're injecting it. And that's where you'll hear people talk about it as tranq or even the zombie drug. And that's why the rotting flesh, the stupor, the moaning, walking stupor that you get in has gained the label, the zombie drug, because of those reasons. So with something so dangerous, why would a drug dealer in Orange County put xylazine in an already profitable product? Xylazine extends the effects of fentanyl. It's a better product because the quick high that you get from fentanyl is extended to a longer high, which increases your customer base now because they want that product, which results in more profit. Second part of it is if you were using xylazine in your product, you're taking some of the fentanyl out. Again, that's more profit for you. Xylazine costs less than $100 a kilogram. It's a veterinary drug. It's very accessible. You can ship it in from China, whereas fentanyl is about $50,000 for a kilogram. So every bit of the $100 product you can sub out for the $50,000 product is, again, more profit for the drug dealer. It's not scrutinized, as the sheriff mentioned. It's not a controlled substance. It's controlled in the sense that only veterinarians can get it, but it's not covered under the U.S. Controlled Substance Act, like cocaine or some of the other drugs that you're familiar with are. Another problem we have with it is its detection. It can come as a liquid or a white or brown powder. And of course, when you take it into a powder form and you mix it in with the fentanyl, many times your users have no idea what they're getting. They don't know that there's any xylazine actually mixed in with it, which can be a problem for them. And they won't know until the person's overdosing and they're hitting them with naloxone and can't get any effect out of it. And at that point, they need to, what we have to stress, and why we're here today, most importantly, is to stress that when that happens, you need to call the paramedics. I know a lot of times users don't want to get the paramedics involved because law enforcement's going to show up with them. But at the point where you're using a Narcan and it's having no effect, you probably have a tranquilizer issue with your partner, and you need to call the paramedics to get them some help. So last thing I'll talk about is why, you talk about these profits. I said that the great profits they're making in this, and I'll refer back to this last note here. I'll refer back to the half a kilogram of fentanyl that was intercepted in Volusia County that was destined for Oak Ridge Road. It's about 1/10 of a gram per $10 bag, right? So you go 10 bags to the gram, 500 grams, you're looking at 5,000 pure doses of a fentanyl xylazine mix. Well, they don't sell it that way because that'll kill you. So they step on it with a cutting agent, an inositol, or some other variation of an inert substance that'll double or even triple that product into 10,000 or 15,000 doses that are being kicked out onto the streets for every half a kilogram. And I'll tell you, that was the second trip we knew they took. We knocked off the second one, but there was another one that went too. And that's the volume of the product that's being kicked out into your streets right now. I just wanted to highlight that as one of the cases. And this isn't unusual. These we've knocked off multiple cases like this. Xylazine is here to stay. It's not a fad. This is a growing trend that's probably going to be here for a few years. Does anybody have any questions?
Question, yeah.
What is effective on it if Narcan
Not available to law enforcement or everyday users. Like, originally, if you remember, Narcan, only the fire department had that originally coming out. Had to call them to get help. Then we got, Narcan, and law enforcement officers had it. And we were able to then start helping faster on scene, get the Narcan in. And now it's spread to the community. Everybody has Narcan. We're not at that stage yet right now. The xylazine issue is a paramedic doctor issue. We're not at the point where we can do anything for you.
And is there any concern about people getting the drug from veterinary clinics around here?
I tell you, it's accessible. You can buy it from China directly. But yes, veterinarians have access to it. People with large horse farms, right? Cattle, they have access to it. And I'll reference back years ago when people think that why would doctors be corrupt like that? We had a huge issue with pain management clinics, pill mills, as we remember. And those were doctors handing out prescriptions of oxycodone left and right when they shouldn't have been. So I'm sure there's access through some veterinarians for this product.
So at this point, you know where it's coming from? Is it coming from China?
Almost certainly it's right now. It's coming. Unfortunately, a lot of our problems are coming from China. But yes, we're the mass majority of what we believe is coming in is coming from China, shipped in.
How does these arrests impact the community?
I'm sorry?
How does these arrests impact the community?
How will this impact the community? Well, at the very least, we talked about, half a kilogram coming in every other week. at the very least, we stop those 10,000 from that group pumping them out into that area. And hopefully we send a message to the other groups in that area that they need to be a little more careful. Honestly, and I know it's kind of on a non-law enforcement aspect of this, is that maybe they'll be more careful with their product. Like one of the issues that we had is they were throwing fentanyl out there, not really mixing it well. Sometimes you get a light batch, sometimes you get a heavy batch. If your, loved one caught the heavy batch, they overdosed. And so hopefully with the targeting of some of these fatalities, our homicide unit now investigates the fatalities and we go after people. Hopefully they're being more responsible. The drug dealers are. It's terrible to say that we have to ask drug dealers to be more responsible with their product. But hopefully with some of the enforcement that's going after these guys, they're being smarter about it. And I will add that they did enhance the penalties for trafficking in both fentanyl and methamphetamines from what used to be a 3-year minimum mandatory sentence is a 7-year minimum mandatory sentence. So there's a bigger punch for getting caught selling fentanyl at higher levels.
Are these people facing any other charges or is it all trafficking?
So there's 4 of them have trafficking. A lot of them have conspiracy. There's a lot of, phone calls, organization, setting everything up. It's a big organization. So they all kind of got wrapped. Honestly, I should probably let the state attorney talk about that one more as far as the charges go.
No, there are various charges that are occurring in this case, but because it is an active and ongoing investigation, we're not able to make any other additional comments about it. But to answer your question, there are some additional charges for these particular defendants.
Are you concerned about quite a few more drug dealers using this in their products as well?
Oh, absolutely. They are already. This was a good case to highlight it, but there have been very similar cases, similarly sized organizations in the same area that have already been taken off that we didn't have a press conference for. They were also using xylazine.
And this might be outside your wheelhouse, but is xylazine addictive, kind of like fentanyl is, or is it just making it more deadly?
From informants, we are hearing that it is. I can't testify as a medical expert, but from the informants that use it on the street, they are saying that it can be.
How long has this rate been active?
I'm sorry?
How long has the rate been active?
To our knowledge, well, we got involved in it. It's the female actually had been arrested. We had done a case on her a few years ago. I don't know exactly the date, maybe 2020, 2021. She was arrested for selling fentanyl previously, and she was incarcerated for, I think, 13 months, somewhere, I'm guessing, somewhere around that time. So we had already been on her before. She got out of jail, restarted the organization, and informant, obviously tipped us into it, and then we grew into the organization. So I got to say, it's at least been running since 2020 when we first bought from her.
Everybody good?
Mina, how are your deputies staying safe when they're coming across this stuff?
Well, xylazine, xylazine, unlike fentanyl, is not going to be deadly to the touch in that sense. I mean, it is a tranquilizer. It is dangerous, but in the sense of you got to be very careful handling, the fentanyls. It's not in that same realm. But we don't know the difference. So in reality is anytime we touch a powder, we assume it's a high strength fentanyl product, and we use gloves. We use all the safety measures that we always would. So like I said, we wouldn't know if there was xylazine in it or not. We don't know what it is most of the time. I mean, sometimes cocaine looks just like it. So they assume everything is the most deadly product, and that's how we handle it.
Okay, we have one more question.
When you spoke about it was the Oak Ridge area, is there a specific area that you were focusing on?
A lot. They move. I mean, they'll come to you. Drug dealers, they'll travel, right? You get them 100 pack, they'll travel that whole area. So you start at Oak Ridge in the trail and you start moving, Wakula, that whole area, all through there. They don't sell on a street corner like the old days. You saw 20 guys on a corner selling crack. It's not like that. They travel. You give them a phone call, they'll deliver, they'll meet you. So when you say the corridor, it's anywhere, any gas station, any CVS along that area, they'll sell. They'll meet you and sell. Yes. Orange Blossom Trail, Oak Ridge area is one of our hotbeds for the opioid epidemic.
Okay, thank you, Captain. Thank you, Sheriff.
Thank you.